Hello, I'm Dr. Rhonda Johnson. Today is Wednesday, July 10th, 2024. By now, many people have heard about Project 2025. So today I'm reviewing some of the proposed changes to the healthcare under Project 2025. This is part 2. Please listen to part 1. I did take the time to read this document, the section on healthcare and HHS. I'm going to read verbatim from this report and summarize my opinions at the end. Now, on page 451, it says President Biden's Health and Human Services are fraught with agenda items focusing on LGBTQ plus equity, subsidizing single motherhood, disincentivizing work, and penalizing marriage. These policies should be repealed and replaced by policies that support the formation of stable, married, nuclear families. That's what it reads. On page 471, prohibit abortion travel funding, prohibit Planned Parenthood from receiving Medicaid funds. Page 480, teach high school students education on healthy marriages, sexual risk avoidance, and healthy relationships. Early interventions and preventions are much more cost effective than efforts to reach people already in broken relationships. Allow child welfare funding to be used for marriage and relationship education. Page 481, protect faith-based grant recipients from religious liberty violations and maintain a biblically based social science reinforced definition of marriage and family. Page 482, eliminate the Head Start program. Page 485, ensure that training for medical professionals, and they specify doctors, nurses, and doulas, is not being used for abortion training. Page 486, prioritize funding for home-based child care, not universal daycare. Page 866, rein in the Environmental Protection Agency, and they must rein in agencies such as the Occupational Safety and Health Administration. Now, this is no longer verbatim. I cannot describe in words the drastic revisions to the CDC, the FDA, and the National Institutes of Health, but they are drastic and sweeping. They are sweeping reforms for the Centers for Medicare and Medicaid Services, also known as CMS. They're reforms for Medicare and Medicaid as we know it. There's a provision to mandate work requirements for able-bodied Medicaid recipients. So in closing, Project 2025 is a comprehensive plan to reshape the federal government if a Republican president, likely Donald Trump, wins the 2024 election. The plan proposes significant changes to the Department of Health and Human Services, as well as many other federal agencies. Project 2025 plans to roll back LGBTQ protections, eliminate federal protections for transgender individuals. It also seeks to prevent transgender individuals from serving in the military and to remove government funding or coverage for gender reassignment surgeries. Project 2025 seeks to eliminate coverage of emergency contraception, abortion, and it totally redefines reproductive health care. The plan recommends cutting funding for Medicare and Medicaid, reforming the CDC, the National Institutes of Health, the U.S. Department of Agriculture, the FDA, based upon conservative principles. Project 2025 proposes the total elimination of DEI programs. So this is a big deal, folks. Read it for yourself. If there's a particular area you are interested in, let's say housing, then search under housing and see what the program proposes. If it's childcare, search under childcare. It's a long document, more than 850 pages long, so I know that's hard to read. But become familiar with this, because if President Trump is elected, this is what you're going to see on day one, according to this plan. That's my message today. Again, I focused on health. It's all there. I read it verbatim. Take care, folks, and be well. I'll send you the link.